Most biological dentists believe that root canals are dangerous and they're dead and they're toxic. Based on the research that we have proven that to be the case, most biological dentists believe that root canals should always be extracted or amputated. Now, the problem is that during the extraction process of a root canal tooth, the toxicity of the physical activity of removing the tooth, say you grab a tooth with a pair of pliers and you remove it from the mouth, the physical activity is going to create a massive toxicity for the body, because the body is designed to quarantine the toxicity and the infection around a dead body part. So, and that's a difficult thing to do, because every time you bite down, a tooth is like a piston. You know, you're chewing on that tooth and you're forcing these gases and the infection into the body. So really, root canal teeth should not be chewed on. But even more importantly, they should be extracted. But the problem with a lot of dentists taking infected root canal teeth out, and even biological dentists taking root canal teeth out, is that at the moment the tooth is physically removed from the mouth, the toxins flood into the body. And a lot of times there are no protocols in place to protect the patient's body from the onslaught, the septic experience that the tooth removal causes, other than antibiotics and pain pills. Okay, so a lot of dentists will give a patient antibiotics, and that's designed to kill bugs. And antibiotics will do nothing for toxicity. It only kills bacteria. And that's a real problem, because not only is the experience septic, taking the tooth out of the mouth, it's also a toxicity experience. So what I decided to do when I became a naturopath is I decided to really study a protocol and build a protocol around what patients can do for themselves in order to make the immune system smarter, stronger, and faster, and to minimize the toxic load on the body during the moment we're taking the tooth out. It's really a two-pronged approach, because I'm a firm believer, and I tell my patients this, that when the laws of nature are obeyed through a toxic and septic surgical experience, that there should not be pain and swelling after the procedure. So while that makes sense, I built a protocol and I put that into practice. And when I do my surgeries, I prepare the patient's body before, during, and after, using infusions and using ways to improve the biome in the body, to improve the gut wall system, to improve what's called the extracellular matrix, which is what I call the inner ocean. So if we can, which is basically the micro and macro excretion or elimination pathways in the body has. If we improve all of these mechanisms prior to the appointment where we take out the dead stuff, and not just one dead tooth. If there's multiple root canals, they all have to come out in the same day. If you leave a little infection over here, it's going to breed infection where the tooth was just taken out, so the body really can't heal that properly. So another one of the major facets of my protocol is if there are multiple root canals, they all have to be taken out in the same day. Just like multiple fires in nature have to be put out in the same day. Instead of a fire department just say, well, we'll put that one fire out today and we'll put that other fire out over here next year when your insurance pays for it. And the problem with leaving fires burning is that they can reignite, and that's what happens in the body with infections, especially multiple infections, and especially in the same jawbones that share the same drainage system, because when you have too many infections clogging up the drains, then the body can't drain, and that backs up the sewer system in the body, and it leads to the much higher susceptibility of the body not able to heal the areas where maybe implants are being placed or bone is supposed to be growing in these areas. The body really can't do that. And of course, it depends on the health of the patient, but even a healthy patient, if you leave the wrong conditions in the body, and you leave a little disease over here and a little infection and a little toxicity over here, and you remove infection and toxicity over here, it doesn't really work. So that's why I believe there are strict laws that are laws of nature that have to be obeyed through a surgical experience of cleaning out toxicity and removing death and disease like that, and gangrene and necrosis in the body and infection. It has to be removed with a safety net under the patient's body while it's done very, very thoroughly. And many times I have the patient sedated for that appointment. It's much, much better when a patient can come in and not have to, mentally and physically endure that. But this is where sedation it's a reset for the nervous system. So my patients can trust that when they have a surgery like that it's going to be done thoroughly, and they can look forward to taking a nap, and we'll wake them up when it's done, so there's no trauma during that appointment. And myself as the surgeon, I can focus really on what I need to do to completely clean the environment and to build blood supplies that have using things like ozone and growth factors. We use the patient's own platelets. We never leave open holes in the mouth. We try to always put in implants. If we have the hole there and the hole where the tooth was pulled can accept the implant, then by all means we try to put the implant in that day, because it really gives the body a physical device that's implanted into the bone that the body can now adhere to, and it really helps the body maintain the bone levels, instead of, when you amputate a bunch of teeth, you lose all the bone around those sites, and it's really debilitating. And once that bone is gone, it's gone. It can be regrafted, but that is a very lengthy, expensive, and not very comfortable procedure, and sometimes it doesn't always work out. So it's just better to do the surgery right in the first place, and to get the patient's body involved in that process, and to be very, very thorough in removing all areas where there's disease, all the dead teeth, cleaning out all of the jawbone where it did not heal properly from having, say, wisdom teeth pulled 20, 30 years ago. That has to be cleaned out at the same time too. You really have to build the conditions in the jawbone everywhere, so that when a patient wakes up from that surgery and continues to heal from that surgery, that things go well. So a lot of our patients that understand this and step up to the plate and say yes to these kinds of surgeries, many of them have no pain whatsoever, because again, we obey the laws of nature going through a surgical experience, removing toxicity and sepsis. Many times patients have a profound improvement in their overall health. Sometimes it happens very quickly, sometimes it takes a little longer, but that's probably the most wonderful thing about the work that I do is for the patients, is that they really get a sense of the impact that their mouth and the disease in their mouth, having been led down the traditional dental path of leaving disease in the mouth and just fixing a tooth here and there, what that has led to is a loss of their vitality and their health over time. And what my patients experience is what it's like to have that bio burden of toxicity and infection removed from the body at the same time. You get rid of both of those at the same time and build back and leave the mouth with conditions that the body knows exactly what to do with that, so that the inflammatory response becomes a tool that the body can use to build and heal, instead of something that it needs to use in order to react to the conditions that are not healthy, so that there's pain and swelling, right? And the big advantage of doing it properly is now the microbiome will come in the direction that you want it to come. You want it to be a probiotic biome in the body, but it's up to the humans to create the conditions so that the biome can respond to that, right? So, you know, and you can't do that by just taking out only the tooth that hurts, or you can't do that by fixing one tooth at a time. The mouth has to be addressed holistically, just like the body has to be addressed holistically. They both have to be addressed holistically at the same time to get the results that we get at BioDentist and using the BioDentist way.